Assalamu alaikum doctors. In this video I am discussing a history that is about sinusitis history. So the exam scenario is like that. Ali, he is a 3-year-old and came with cough and fever. So the chief complaint is cough and fever. So first we chief complaint analysis, onset course and durations, what make it better and what make it worse. Then how had it started? Had he turned blue? Is it more at night or same all through the day? So more at night we need to ask, describe for me his cough. Is it chesty or wet? Did he lose consciousness? Anyone tested his oxygen in the blood? If wet, ask about the color of the sputum. If there any blood in it, is there any choking, any chest pains? Ask about the previous exposure to trigger, exercise, cold, upper respiratory infection, drugs, pets, smoking, contact with COVID patient. So remember, trigger is very important. Cold, upper respiratory infection normally sinusitis triggers. This patient has a low-grade fever which was relieved by analgesic. So we ask about the details. What about the fever? How was the highest point? How you listen it? Okay, so it is a low-grade fever. And also we ask about the atopic march like any runny nose, red eyes, skin eczema, food allergy. So this is very important, asking atopic march, runny nose, red eyes, skin eczema and food allergy. These are sinusitis. Then any recurrent chest infection, recurrent ear infections, okay, recurrent chest infection, recurrent ear infection. Does he look like you and his daddy? And any other concern. Again the chief complaints I am telling. Our chief complaints is cough and fever, and we analysis how OCD, what make it better and what make it worse. How had it started? He turned blue? Is it more at night or same all through the day? Describe for me his cough. Is it chesty or wet? Did he lose consciousness? Anyone tested his oxygen in blood? If wet, ask about the color of sputum. Is there any blood in it? Is there any choking, any chest pains? Ask about the previous exposure to triggers like exercise, cold, upper respiratory infections, drugs, pets and smoking, contact with COVID patient. This patient had low-grade fever which was relieved by analgesics. Ask about the atopic march, runny nose, red eyes, skin eczema, food allergy, any recurrent chest infection, recurrent ear infections. Does he look like you and his daddy, and any other concern? Then about the systemic review one by one. CNA, signs of increased ICP, intracranial pressure, abnormal movements, facial asymmetry, fits, eye deviations, abnormal behavior, any concern regarding his vision, hearing or speech, any changes in his head size. GIT about the tummy pain, tummy size, poo nature, and if he had loose motions before, ask about the poo control, recurrent attacks of loose motions, perioral or perianal rest, any recurrent mouth ulcers. CVS awareness of the heartbeats, chest pain, how many pillows, anybody, edema, like eyelid, lower lip and tummy. About the urinary pee control, pee color, amount, painful peeing, blood pressure measured, recurrent infection in the pee system. MSK about the skin spots, describe skin discoloration, joint pain, joint swelling, bone aches, anybody lumps, especially in the neck and armpits, hair or nail changes. Endocrine, the blood glucose tolerance to hot or cold, swelling in the middle of the neck. Nematology is pallor, bleeding, recurrent bugs, bruises, recurrent abscess formations. Past history is 5T IUA drugs if he received. In details, this patient had previous recurrent attack, each time received amoxicillin, but the mother did not complete the course. Travel to endemic area with tuberculosis. So past history we can be find the child has this is recurrent attack and child take amoxicillin history, remember, and also traveling to endemic area present. Parental history as usually pregnancy, maternal disease, drug, illicit drug, delivery time, type, fast cry, needed some resuscitation, NICU admission. Vaccination, did he received all his shots, any scar at the upper part of his left shoulder as BCG scar, and COVID vaccination. Allergy, certain type of food or other allergies, nutrition in detail, what about his meals. Development in details, family history of similar condition, family history of immunodeficiency, home aeration, anyone smokes at home. Psychological impact, how does his condition affect the family? So this is history, and our DD we can keep first of all sinusitis, allergic rhinitis, rhinosinusitis. If recurrent, it can be immunodeficiency. Again, our DD are sinusitis, rhinosinusitis, allergic rhinitis, and if it is recurrent, we can tell immunodeficiency. Thank you.